Hi everyone, Dr. James here, and what I'd like to do in this video is share with you how your relationship may change with your healthcare provider, not only in the office or clinic, but also in the surgery center or the hospital setting. So let's talk about the office first. Well, first of all, a lot of us are using telehealth. That allows us to speak to you where you don't need an examination, face-to-face, no matter where you are, and that allows us to treat you with your situation without having you come into the office. Now, the obstacles to that include insurance companies that don't want to pay for that, malpractice, because basically, where's the malpractice covered when the patient is not in the same state? So if a patient is doing a telehealth visit with me from, say, Indiana, and I'm in Florida, does the malpractice cover Indiana? Does it cover Florida? When a patient comes from Indiana to my office, of course, it's all in Florida. And the other obstacle is technology. It's difficult sometimes for patients to log into the telehealth website or the waiting room, but people are getting better with that, and the telehealth webinars are becoming easier to join and to figure out the different settings, the microphone and the video. Now, what about the office? Well, I'm sure in the office, each country and each state is going to have their own protocol, and each hospital system is going to have their own protocol. But most likely, you will have your temperature taken with the forehead thermometer. You may be asked to wear a mask in the beginning, and your healthcare provider may also wear a mask. When you're being examined, most likely your healthcare provider will wear gloves. You may have to skip handshakes or hugs and things like that. It all depends on the different situation. It also depends upon whether you're in a hot spot or a low spot. Right now, where I am in Florida, we're in a low spot, so we have very few COVID-19 cases. It's actually SARS-CoV-2 as the virus, so it's SARS-CoV-2 cases. So that may change, and protocols for the office will be set up by the office administration or by the hospital system that manages or owns the office. Let's talk about the hospital. Once again, that depends on where you live. If you're in a hotspot, as we call it, no matter what country you're in, the hospital will have its own protocol of screening you before you enter the hospital. As time goes on and tests are rapid, you may receive a test before you have surgery. You may be tested with either an x-ray test. Some countries are using CT scans of the chest right now, where eventually what will happen is you'll probably have a rapid antibody test or a rapid SARS-CoV-2 test or COVID-19 test. And then that will help to see if you're okay to have surgery. Of course, emergency surgeries happen no matter what the situation is. So your relationship in the hospital will change somewhat, but for you, you won't notice much of a change in the hospital because your surgeon will change different protocols in the operating room. The way they manage laparoscopic surgery, the way they manage the gas, the way anesthesia intubates you, that may change slightly also. Now, surgery centers, usually they guide themselves, and sometimes the state will also give certain regulations to surgery centers on how they should conduct things. But I think local management will be up to the center or the operating room itself. So just to summarize at this point, it all depends upon what country you're in, how the pandemic is in your country, whether you're a hot spot or a low spot, and also it'll depend upon the individual regulations. But I think things will change just slightly where we're going to do more telehealth and we'll wear more masks and more gloves when we're taking care of you. So I hope that helps. Once again, this video will probably be out of date in a few months as things change, and once the antibody tests become more available, that will change. We'll know who's immune, who's not, and also the tests that can detect whether you have the SARS-CoV-2 virus. Once they become readily available, that will also change the way we manage patients and the way we greet and meet you and treat you. All right, be safe, be careful, and we'll speak to you soon. Thank you.